Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, everybody. Welcome to this week's edition of The Holistic Nurse with Peggy Smith. As I've said in the past descriptions of our platform, my definition of holistic is not just the different complementary modalities, but it's looking at our whole life and our health and everything related to human that, keeps us going. And this week, we're going to be talking about why eye health is not a luxury. And, given the climate and the insurance issue challenges, I wanted to make sure people understood why eye health is just as important as going, to your regular primary physician, your psychiatrist, or whatever. So I'd like to welcome Dr. Michele Pendrak. She is with the Dry Eye Clinic at Siepser Vision in Wayne, Pennsylvania, and also associate of Wills Eye Hospital here in Philadelphia. It's an internationally known hospital. And welcome, Michele. Thank you for coming today.
Yes, thank you so much for having me. I really appreciate this. This is fun.
So, would you like to start off, give maybe a real quick background or what you do in your practice?
Sure. So I practice in King of Prussia, Pennsylvania, and same building as Peggy. And we have mainly historically it was a surgical practice with Dr. Stephen Siepser being the surgeon. I understand he'll be on the podcast in a few short weeks here. When I joined the practice back in, it was 2014, I was informed that we would be starting a dry eye center, and Dr. Siepser wanted me to take the reins on that. And the thinking was when you're getting any sort of ocular surgery, there's going to be dry eye associated with it. And so this was really, in essence, a way to help our patients get through their ocular surgeries with more precise, predictable outcomes, with more comfort. And what we realized was dry eye is really prevalent. And so we started the Dry Eye Center, and it's obviously not just for our surgical patients, it's for everybody. So there are 2 days a week. I am exclusively in the Dry Eye Center treating dry eye patients from the beginning to the end of the day on Tuesdays and Thursdays. Wednesdays and Fridays, I'm doing a little bit of everything, front to back of the eye health, glaucoma, macular degeneration, diabetic eye health exams, your regular routine glasses and contact lens exams, although most eye care is anything but routine, of course. And of course, in a lot of those exams, I'm finding dry eye. So that's mostly what I am up to these days. And of course, that's how we met. We're in the same building, and Peggy came to me as a patient. And so it's been, I was offered to come on the podcast. And of course, this sounded like a really great opportunity to get the word out about, I love how you put it, how eye care is not a luxury. I think it's really an afterthought for a lot of patients. And I know we as eye doctors understand that we have a lot of education to do with the general public. Dentistry has done it right. They have people understanding that you have to get your eyes checked your teeth checked and cleaned once every 6 months. And then you have to go home and you have to go do a little daily maintenance on them. And the eyes are really the same way. We should be getting them checked at least once a year. And they are a really big part of our health. They're a window directly to your brain, a window directly to what's going on in your cardiovascular system. We should be getting them checked once a year, and we really do need to be doing some daily maintenance on them at home as well. So broad overview of what I do and my little soapbox about hopefully one day we can get people educated on how we should be taking care of our eyes.
And in my traditional nursing practice, I do a lot of home care. And what I've noticed going back many years is, especially if you have certain commercial insurances that don't cover it, there's not a line in your home budget for eyes. But I've always been because I wore glasses since I was like 4 years old. I think my piano teacher first told me there was something wrong. I'm playing notes on different lines, and she was pointing to. Um, and then later, the band director told me actually that I was tone deaf. Didn't know I needed hearing aids. So it's amazing. But
Um,
I was attending another vision practice in the mainline health here in Philadelphia area, and one day the doctor said to me, "How long have you been a diabetic?" And I said, "What are you talking about? I'm not a diabetic." Um,
mhm,
and that's when I learned that looking at your eyes, you really can learn so much about your total health. Um,
mhm,
it turned out, yeah, my A1C was a little bit elevated, but I was working as a night shift nurse, and we stay awake by eating all night, and it's usually not the healthiest foods. Uh,
mhm,
so I was able to get that under control fairly quickly. I was adopted, so I don't know my medical background
mhm,
familiarly. But I did know that I was down the road. I had cataracts that were and glaucoma risk way back more than 20 years ago, and it was always checked
mhm,
regularly. The doctor that would have finished that story retired. And since I was already in your building, I looked at my options here, and I'm really excited that I did. Um, One example, in the first eye surgery, Dr. S had found a problem with that membrane that I had that protects your eye. Uh,
mhm.
so he told me he had to remove it. And the next day with the post-op, he says, "And one naked cornea." And I said, "So what are we doing about it?" And he said, "I told you I took it off." And I said, "Well, isn't it going to grow back?" So I've learned a lot this year. It doesn't grow
Mhm.
back. Um,
Sure.
and I didn't know that as small as your eyeball is, you've got doctors for every part of your eye. There's a doctor for the front of
Mhm,
your eye, doctor for the middle, the back. And it's just been a really enlightening experience. And what I've learned with my home care patients, nobody washes their hands before they do eye drops. Most people are not compliant with eye drops. and
mhm,
and my mother's case, now she was living down south, died at 96, was blind the last 10 years of her life just from
mhm.
and here in Philadelphia, that really wouldn't happen because we had the
No.
eye drops, the access to care. So the
Mhm,
across the country, there are inequities in healthcare that's available.
mhm,
Um, she didn't. Nobody even offered her eye drops, and she went blind the last 10 years of her life completely. My
mhm,
roommate in college was visually impaired. She was, I think she had bilateral uveitis or some kind of inherited thing. Both her father was totally blind. A sister
mhm,
was blind. She just retired from as a computer programmer in Arkansas. For the last 40 years, she's had a functional job. Um,
mhm,
Seeing eye dog and modification of her equipment. She had a full productive life.
mhm,
And in college, she used the Library of Congress for the Blind here in Philadelphia to have all her textbooks recorded.
mhm.
She was generous enough to go through the dorm and get everybody's textbook list. So all of us went to bed every night listening to our textbooks at the courtesy.
Aw.
You can't do physics under your pillow. I can tell you that. Uh,
Love
but
that.
what I've also seen, nobody really thinks the eye drops are that important. I've learned even as I'm going through temporary treatments, if I'm busy, it hasn't been the priority, and
Mhm,
it does affect me. My lack of sleep affects my vision. The weather affects my vision.
mhm.
I rescue special needs animals. You're always giving puppy kisses and cats hair.
Yeah.
Um, and so there's a lot of education, and that's when I met you. I wasn't even listening to what you were telling about me personally. I was like, wow, this person's got so much knowledge that she's got to share it.
Oh, why, thank you.
So I'll let you, take it from here, whatever you think would be most effective to help people, whatever message you'd like to share to get out to people.
Sure. And I think you brought up so many excellent points there. Starting with talking about how you went to the doctor and the doctor said, "So, how long have you been a diabetic?" We can figure out a lot about your overall health just from looking at your eyes. I know even from a dry eye standpoint, people think I have some sort of, sixth sense because all I have to do is pull down on their lids and do this. Okay, maybe there's a little more to that, but there's a lot I can learn just from looking at people's eyelids and pulling down and seeing the elasticity of their lids. You know pretty much right away if that's somebody who has sleep apnea or not. And so I'll be going to put the eye drops in somebody's eyes, then I'll look under the slit lamp, I'll see a few other signs, and then I'll say to somebody, "So, has your doctor ever suggested you have sleep apnea? Have you ever been worked up for sleep apnea?" And they kind of look at me like, "Well, Yeah, as a matter of fact, I had a sleep study or I use a CPAP, and they can't believe that this is the kind of information I've gotten in, the first 45 seconds of an eye exam. And things like that can have a huge impact on your overall health. I met with a sleep apnea specialist in the area, and it affects everything because you're basically losing vascular blood flow to your entire body every night throughout the night. So, from an eye standpoint, that increases your risk of glaucoma. That has a huge impact on dry eye. From a health standpoint, as a nurse, I don't have to tell you this, but for our viewers, that increases your risk of anything cardiovascular related. It increases your risk of diabetes, and it's a lot more common than a lot of us think. So there's this huge crossover with what I do and so many other specialties. And so a lot of times we are sort of a gateway to figuring out, oh, this could be something else that's going on. Maybe we need to send you to that specialist. And so we've worked really hard here at Siepser Eyecare to make sure that we have good relationships with the other specialists in the area, because a lot of times we're funneling patients to them, they're funneling patients to us. And I'll get patients in here and they'll hear these stories from their friends, and they'll say, well, my friend went to the eye doctor and my friend figured out that he or she has high blood pressure. So I'm here because I want you to check my eyes. So it's kind of cool to get those sorts of stories. But again, that's where the education to the public comes in, that it's so good to get that once a year check, because we understand that. Again, going back to, I love the story about how your piano teacher told you to get your eyes checked. We feel like there's a lot of things where we're catching in a routine eye exam. So people will come in because they need glasses or they need contact lenses. And while they're in for their routine exam, we just so happen to see, oh, your prescription has shifted around a lot. You might want to get your blood sugar checked, or the example I gave with sleep apnea. So we just so happen to catch medical issues at a vision exam. And it would be nice if one day we get to the point where, well, people know, hey, I need to get my eyes checked once a year for my overall systemic ocular medical health. Because you think about how many people, their vision is totally fine. So they think, well, I don't have to get an eye exam. And that couldn't be further from the truth. At its most basic level, there is so much going on in the back of the eye. There could be growths, hemorrhages, little tears, little holes, things that are small problems now that could be big problems later on. Things like glaucoma, for example. Glaucoma is painless, it's slow. It happens extremely slowly over our lifetime. And the only symptom you would ever have is over decades, your peripheral vision is slowly decreasing. So unless you're coming in for regular eye exams, this is why people think it's an aging disease. It's not. You've had it your whole life. It's just something that wasn't found or that didn't impact you until later on in life. And so early intervention is the key. You bring up another excellent point with eye drops. Of course, people are non-compliant with eye drops. It's hard to remember to take them. They're expensive. I had a colleague, another physician in recently from another specialty, and he looked at me and said, well, you guys in your profession, you're known for having the medications, meaning the eye drops, that are hard to get and expensive. And I thought, well, gee, I didn't know we were that much worse than everybody else. I know that my poor technicians are busy all day long doing prior authorizations and fighting with people insurances. But the struggle is real, as they say, with trying to get eye drops. So we do a lot here at Siepser Eyecare to actually try and get patients off of their drops. So for example, with glaucoma, our first line treatment is a laser called an SLT for glaucoma that is 80% effective. It's covered by your medical insurance. It doesn't impact your vision. If it works, great. If it doesn't, we move on to the next thing. I'm not super excited about having patients on drops for their glaucoma, because every drop is going to cost you money. You've got to go to the pharmacy. You've got to get it. And every drop is going to have a side effect. It's going to beat up your ocular surface. It's going to cause dry eye. And there is definitely that hierarchy in eye care where, okay, glaucoma trumps dry eye, right? You could go blind from glaucoma. A lot of people sort of have that thought where dry eye is just a nuisance. But on the other hand, dry eye can impact every blink. It can impact every second of your life. It can impact the way you see. A lot of people don't realize that. A lot of people don't realize that that fluctuating, filmy, hazy vision that they're getting, they could be totally comfortable, but that filmy, fluctuating vision, that's dry eye. People don't realize that the tearing and the mucus they wake up with in the morning, that's dry eye. People think it has to be this like sandy, uncomfortable feeling, and it doesn't. So that's where somebody like me comes in. That's why it's so important to come into your eye doctor and get your eyes checked regularly. So many people come into the dry eye center and have that experience. So I know that you've seen me for dry eye. So were you one of those people? Were you aware you had dry eye, or did we kind of have to tell you? And we had to dig a little bit further.
Because they had to remove that mucous membrane in both eyes, and from what I understand, that there is a hereditary factor with that issue. I still don't even know what that issue is called for. I'm still looking it up.
Mhm.
And Dr. Google does not help you with eye problems. I'll tell you that.
No.
Um, but because of that, I just assumed it was a natural side effect of the whole process that I'm going through.
Hmm.
Um, a lot of people don't know, and a lot of my home care patients, I've actually had to order on Amazon that cup that goes over your eye, because not only are eye drops expensive, when you're trying to put it in your eye, you miss your eye half the time. It goes in your cheek, on your nose, or anywhere else, and you're wasting your eye drops that too. Um, that so that they make a nice little cup that sits over there, actually lines your eye. You get it right in your eye, and it's much
Mhm.
more sanitary as long as you clean it after you
Mhm.
use it. It's like your
Sure.
CPAP. Many people don't clean their CPAP like they're supposed to, and that's going
Yeah.
to lead to other problems.
Yeah.
Related to the CPAP, one question that came up, because of that pressure of air that's being pushed in to make the
Mhm.
person breathe, is that extra air also contributing to the dry eye? Some of that might leak out over the mask to your eye.
Oh, 100%. Yeah. If you have sleep apnea, if you're using whether or not you're using a CPAP, but especially if you're using a CPAP, you're going to have dry eye. And there's a few reasons for that. One of them is because, and I swear this is the medical term for it, if you have sleep apnea, that is linked to floppy eyelid syndrome. That is an actual medical term, which basically means that your eyelids are loose. And then when you sleep overnight, you don't get perfect lid closure. So you already have that little bit of incomplete lid closure, which means that a piece of your cornea is exposed overnight when you sleep. And then you're more likely with any sort of device that you're using for sleep apnea, whether it's more of a nasal cannula or whether it's the CPAP, it's going to pull down on your eyes like this, and then your lids are more prone to being pulled down. And then if it leaks on top of that, I mean, that's just the perfect storm. That's going to set you up for dry eye. And so I love you talking
Maybe
about
some
people.
infection, because then you've got warm,
Mhm.
moist oxygen being humidified into
Exactly.
your eye. Uh,
Exactly.
when I was adopted, I was young enough to still be taking naps sometimes, and my mother was always close your eyes and go to sleep. She thought I was deliberately not going to sleep. Apparently,
Oh,
I always slept with my eyes open, and
yeah. Yeah.
husbands have told me that that's kind of creepy, and I never know it. I'm not looking at my eyes, but now that you're saying that, I'm learning something new. I'm sure that's a factor in my dry eye right now that I'm experiencing, because
Oh,
I think I still sleep with my eyes. Um,
yeah.
and
It's
you know, I
79% of patients with dry eye. 8 in 10 patients with dry eye have incomplete lid closure, and there's different degrees to it. So it's not just like you and like me. I do it too. It's not just the freak your spouse out, sleep with your eyes open. It could be just that the lids overlap, or you don't maintain that perfect closure overnight. So if you're waking up with your feeling like your eyes are dry or irritated, yeah, you're probably one of those 8 in 10 patients with dry eye who have incomplete lid closure. Super
think I
common.
was blaming it on this other stuff that's going on in my life.
Mhm.
Another question that just popped up. So many people that are getting a cosmetic surgery, the Botox
Mhm.
plan.
Mhm.
Have you
Mhm.
found that a lot of people do get Botox around their eyes to get the wrinkles gone, things like that? Are you
Mhm.
finding complications related to that? That's a common procedure now.
Yeah, yeah, absolutely. So it's funny, Botox is a mixed bag because there's certain areas where it can help, but there's definitely certain areas where it makes it worse. So
I know
there's
it's used in Bell's palsy, especially people that
Mhm.
have issues around on their face like that. But
Exactly,
you know, they
exactly.
say
So I like the migraine protocol. It's good for that migraine region. It's even good. They've played around with Botox, sort of like closer to the eyelid region here, to help with people, in a Bell's palsy situation, or people who have really dry eye and they have the friction from the rubbing. But I can't take credit for this. This is Dr. Laura Perriman. She's another dry eye specialist. She calls this area, the crow's feet area, the Botox free zone, because this is the area. If you're getting Botox on those crow's feet, hate to say it, everybody, but that is making your dry eye worse. We do know that for sure.
Okay, and back to what you guys can magically see looking in our eyes. A couple years ago, I had a rescue. It was kind of a crazy Chihuahua.
Mhm.
I rescue all breeds, but I just assume when I have a Chihuahua, they're all crazy. And, my husband was ill, and I needed to farm out some of my dogs temporarily. My dog groomer had him, and then as my husband was reaching the hospice state, he said, that was his baby. Why don't you actually bring him back so he can say goodbye to his dog? And he said, and by the way, I think he needs a specialist because I don't think this is just crazy Chihuahua. I think he's got a neurological problem. So
Mm.
I had to bring the other dog to the vet. I brought Peanut around, and he goes into one of these seizure episodes just right in front of her, like almost on cue without us asking. And so she stopped what she was doing, got her lights out, and she looked. She says, "Your dog has a brain tumor." And
Oh,
the dog was already 12 or 13. We could just treat the seizures. We don't, I don't expect you to do anything else. But I was just amazed that here again, the eye doctor is diagnosing, why am I, some people get expensive CAT scans, and, you
yeah.
can look up the eye and see, so again, it goes to the credit of your profession, which I know.
Mhm.
I run into people that maybe had cataract surgery years ago. And
Mhm.
one in particular I'm thinking of, something went wrong. She got sent to Will's Eye Emergency, ended up losing her eyeball. They had to take the eyeball out. The other eye is not very good vision, but
Mhm.
it's been like we're talking 10, 20 years. Is there something that now with the modern research and everything, she just figured she's due to eventually lose all her eyesight. There's nothing that can be done. And I was telling her,
Yeah.
you know, if somebody's had that kind of experience, are some of these things correctable now, or is it probably not? You can't reverse something.
Yeah, I mean, it all depends on what it is.
Right. I don't know
Yeah,
clinically exactly what happened. Yeah.
yeah, I mean, with the cornea, I have seen patients come in and see, the cornea is the clear dome that goes over the front of the eye. Dr. Siepser, among other things, is a corneal surgeon. So I have seen patients come in to see Dr. Siepser, and they have, scarring on their eye from a herpetic, which is basically a shingles infection, for example, from years ago. And they're like, they told me there was nothing I can do. And there's plenty that you can do to clear up the cornea. So I've seen him give vision back to people who thought that they couldn't ever have vision again. On the other hand, if it's the retina, which is the wallpaper on the inside of the eye, that's sort of a different story. The retina, I know this analogy is going by the wayside because people use their phones now. They don't use the old school digital cameras. But the analogy we used to say, and not even digital, sorry, the film cameras, we used to say if your eye is like a camera, the retina is like the film inside of the camera. That's where the image is getting formed. If the retina was damaged, that's sort of one of our last frontiers in eye care, where there's so much work being done. There's gene therapy, there's stem cell patches, there's so much being done to work on the retina. But unfortunately, if there's been damage done to the retina, there's not a lot we can do to fix that right now. And that's not to say you shouldn't still, go to a retina specialist if we catch something going on in the back of the eye. There's macular degeneration is so common, especially with the demographics of our population right now, with, the baby boomers sort of reaching that macular degeneration age. And there's new treatment for that now. It used to be just, well, you used to have the worst kind of macular degeneration and you get injections in the eye and it prevents it from getting any worse, but you don't get any of your vision back. Well, now there's an intermediate stage of macular degeneration. And now there's a treatment for that where there never was before. So now there's something we can do to slow down that type of macular degeneration. So the retina, it's been slow. We're getting there. But the back of the eye has been a little bit slower than the advances we've had on the front of the eye, but we're working on it.
Well, years ago, I had a cat scratch in my eye, and the doctor that I was seeing the first couple of weeks, he was making me come to. They told me to come. I had daily appointments. Then it was every other day, and I thought, oh, for God's sake, it's only my eye. Well, that was my attitude 20 years ago. I was
Yeah.
kind of annoyed that I had to go every day, you know, and that's where the attitude of gratitude comes in. I might not have these eyes now to have the problems that they're having if I had let that go. But I've noticed
Sure.
not doctors that I've met over, with my patient profiles, they've had corneal abrasions and they just give them some drops and an antibiotic and don't see them again. Come back if it's still bothering you. Uh,
Mhm.
so I guess the message there might be listen to your gut. If you know something's still not right, get another opinion somewhere.
Mhm.
I had a viewer that just posted that she learned the hard way that a pillow can actually draw moisture away from your eyes,
Mhm.
uh, and that she had to learn how to keep her eyes off the pillow and only support her neck because of that. Have you heard of that?
Um, the mechanism that I can see behind that certainly would be going back to that thing we talked about with incomplete lid closure, where,
Okay.
and certainly, there's a lot to be said about the material of the pillows, right? But when I talk to my patients about sleep and their pillows, it's a lot more like, are you getting this effect? Is the pillow pulling on your eye? That is incredibly common. And there's a lot that we can do for that. And I'll talk to my patients about sleep. And, I understand sleep is a really individual thing. While 8 and 10 people have their eyes open a little bit when they sleep, and also understand that it's really hard to get a good night's sleep. And if that overhead ceiling fan is really what's helping you out, all right, well then let's talk. They have goggles. They've got these little clear adhesives you can put on your eyes overnight when you sleep. They've got ointments. There's a nasal spray now that helps with that. So there's all sorts of really kind of cool tools we have in our toolkit that we didn't have even a decade ago to help with this sort of stuff.
That's interesting. I know that I guess another problem that I see with people, and even with what I've experienced this year, it seems like if we talk about the sleep habits, the Harvard Medical School has talked for 20 plus years about the blue light effect and how you should turn off all electronics an hour before you
Mhm.
go to bed. And
Mhm.
that includes your TV, and you shouldn't have a TV in your bedroom and things.
Mhm.
And I notice if I'm up late on the computer, my eyes are very dry,
Mhm.
uh,
Mhm.
and I wake up even drier no matter what I do for them. And I kind of laugh and say, "Yeah, I guess Harvard Medical School was right." But I don't make that extra jump. Maybe I should change my habits, and but vision is usually not something that comes back. I mean, like with the cochlear implants for the hearing impaired, we can
Mhm.
restore. And I know there's special glasses and things now that can
Mhm.
enable
Mhm.
um, the ability to see things that they never saw their entire life. There's so many research; it's just amazing what's going on.
Mhm.
Uh, but it's all about preventative health care, and
Mhm.
I guess there's a lot someone can do. Even when you need the doctor at least once a year, I'm sure, to check on things.
Mhm.
What can a person do in their lifestyle, nutritionally, or that type to maybe stave off some future problems?
Sure. So I always say to people, if I could pick one thing for you to do to your eyes, it's take a really good quality omega-3. There is one specific one that I recommend, but the things you look for are you look for re-esterified triglyceride-based form omega-3s. And then from there, it's you look at the EPA to DHA ratio. EPA is anti-inflammatory. DHA is your neurologic support or your brain food. And there's so much research around this stuff. This is like the one thing I wish people understood a little bit more. Basically, we should have an 8% red blood cell saturation level of omega 3s just to be getting therapeutic benefits from our omega 3s. And we have to remember that omega 3s are an essential nutrient. So that puts it on the same playing field as vitamin C. Well, what happens if we don't have enough vitamin C? We've seen examples of that in history. We get scurvy, right? What happened when we had folic acid removed from our wheat products? Unfortunately, we got spina bifida. So if you think about it that way, the fact that omega 3s are an essential nutrient and we are severely lacking in it, especially here in the United States, it makes you wonder, well, what we know we need it head to toe for overall body health. And I'll get to the eyes in a moment. But it makes you think, well, we're also deficient. And we know this from blood work and we know this from research. wow, what essential nutrient deficiencies, like how has this manifested? And it's kind of scary to think about, because while we know we need to be at 8%, the average North American is walking around at about a 3-4% omega index. And we know from the Framingham offspring cohort, so it's like this big, long cohort of patients that we've been studying, like we've been studying them their whole lives for decades. It's the longest running study that's ever gone on. We know from that cohort of patients that having a low omega index, they looked at all of these predictors of early death, and they found that having a low omega index was as strong a predictor of early death as smoking. So you think about head to toe, we know how bad smoking is for us. That's how good omega 3s are for us. But we're all walking around at a 3-4%, which is abysmally low. And that's a side effect of the standard North American diet. Omega 6s are pro inflammatory. They're found in processed foods, vegetable oils, corn fed cattle, unfortunately, even farm raised fish. Whereas omega 3s are found really only effectively in the diet and wild caught fish, because our bodies don't process plant-based sources of omega-3s like alpha-linoleic acid the way that they should. And so we should be consuming omega-6s to omega-3s in a 1-to-1 ratio. Unfortunately, we consume them in the United States. We have an omega-6 to omega-3 imbalance to the tune of a 25-to-1 imbalance. So that's a lot of inflammation in our diets, and we're not getting the anti-inflammatory side on the omega-3s. So we see that reflected in the eye. When I press on people's oil glands in their eyelid, that's why I see toothpaste coming out of these oil glands and not nice, clear, healthy olive oil, because the omega-6s, the pro-inflammatory omega-6s, which at body temperature have the consistency of butter or lard, are solid coming out of the oil glands. And that's why we say 86% of dry eye comes from your eyelids and is evaporative in nature, because most of us are walking around with too many omega-6s in our diets. It's gumming up things like the oil glands in our eyelid. And that oil should be coating the top surface of our tears, and it should be acting as a moisture seal. If you don't have enough good quality, healthy oil, basically you blink and everything just evaporates. And this catches up with most people eventually. You talk about the computer and screens. We normally blink 16 times a minute. When we're looking and concentrating on anything up close, screens being the worst of it, we blink 4 times a minute. And then what's happening between those 4 blinks per minute is a ton of evaporation. So I don't know how anybody, quite frankly, works on the computer comfortably with all of this kind of stuff going on. So what a good quality omega-3 does with a lot of EPA in it, it decreases, EPA is anti-inflammatory. So that's what gets inside of the oil glands, rearranges them and clears them out. And we've tested this, store brand alcohol-based form omega-3s only get you to like a 5-6% blood saturation rate. So that's why people take store brand omega-3s all day long at this lower dose. Those alcohol-based form omega-3s, they're only 30% bioavailable. So you're never getting to therapeutic levels. And that's why all these people take omega-3s. They've upset their stomachs because that's the ethanol being released from the alcohol-based form omega-3s into their system. It's upset their stomachs. They haven't seen a health benefit and they give up on it. And I don't blame them. So you have to, the supplement industry is so hard because it's unregulated. And these companies have all figured out ways to cut corners. And so the omega-3 industry is one of the worst offenders. And they figured out, hey, we can skip this last manufacturing step and create a really, I'll use the word cheap. I was going to use the word affordable, but let's call it what it is, a really cheap omega-3. And we'll put it on the shelves in this alcohol-based form and who cares? But unfortunately, they're causing a lot of inflammation. They're not getting you to therapeutic levels and you never get benefits out of them. So that's where a good quality omega-3 comes in for the back of the eye health. So that's macular degeneration. That's we're thinking maybe even there's something to be said about the benefits you can have for glaucoma. Diabetic eye health for sure. We have a ton of research that tells us that DHA is really important for back of the eye health, because at the end of the day, the retina is essentially a slice of the brain. It's a piece of neurologic tissue. And so it's funny to see this research cross over. Anything that's good for the retina is good for the brain. So we know, for example, that if you have a high omega index level, a lot of DHA in your red blood cells, those are the people who have a 50% decreased risk of Alzheimer's disease. And we also know that if you can get your omega index level up on the DHA side, that you decrease your risk of diabetic retinopathy by 50%. That's damage to the back of the eye from diabetes. You decrease the risk of macular degeneration by 50%. Even if you don't personally have it, even if you just have a family history of it. And I hear this all day long. Patients who are coming in and saying, you know what, my eyes are pretty good, but now I'm driving my mother or my father or whoever to the retina specialist, and they have wet macular degeneration and they're getting injections, and I know it's hereditary. And is there anything I can do? Omega-3s, that's the thing you can do for sure. But it's got to be the right one. From a dietary standpoint, obviously, it's all about the anti-inflammatory diet. People are always asking me, well, how do I do this with fish? Well, unfortunately, we also know there's a lot of pollution in our waterways. To get the right amount of omega-3s, you'd have to eat, if you do a side-by-side comparison of what you get out of the right type of omega-3, 3 capsules daily for a week is the equivalent of 37 cans of tuna. So unfortunately, the way our diets are set up, it's really hard to do it through diet alone. And that's why when it comes to that particular thing, yes, anti-inflammatory diets for sure. But a lot of us, unfortunately, just need to supplement. And I've seen this have a huge impact on once they start the right supplement. On my patient's health. I've seen it help my patient's blood pressures come down. My mom's on this. It took my mom's cholesterol down 100 points. It's helped me. I did not win the genetic lottery metabolically. I've got diabetes, I've got cholesterol, all in my family history. And these supplements have helped keep me off of medications for all of the above. So I can see my patients, I can see who are diabetic when I start them on the right supplement. You see their A1C levels come down. People who historically had high A1Cs, I'm doing it to protect the back of the eye, but it's really cool when I ask them their A1C every year, and all of a sudden their A1Cs are in that ideal range again. So that's the one thing from a dietary lifestyle standpoint. That's the best thing you can do, not just for your eyes, but for your overall health as well.
I think it's important too for viewers to realize that when you're taking supplements and maybe you read something or you hear you talking or whatever, all of your providers need to know exactly what you're taking. I've had people get really good results with other vitamins. I can't tell my doctor I'm doing this. He'll think I'm crazy. And so they don't. And I said, well, you need to, because if you need surgery, it's going to make you bleed. It's got some supplements you have to stop before you have surgery.
Right.
And another point I haven't heard you mention yet, but I have a feeling it's important, is hydration. I had a guest a few weeks ago, a shaman from South Africa, and he pointed out that in America, we don't drink 1/3 the amount of water that we should be drinking.
I bet. Yeah, I
And I've
believe it.
noticed on days that I don't drink because maybe it's inconvenient to get to the Wawa to use a bathroom or something, my
Right.
eyes are a lot drier, and I'm tired. My brain is foggy, and everything. A lot of things are going
Mhm.
wrong because I'm not
Mhm.
drinking enough water.
Yeah.
Um,
Yeah.
so,
I mean, you
as
see
part
me,
of
I've
your
got my
profile,
bag. I drink a few of
I
these a
see
day.
that. Yeah.
Definitely. I don't just carry it around. I actually drink mine. But yes, thank you for bringing that up. There is a water deficient. It's a less common type of dry eye, but there is basically you don't make enough tears. There is a water deficient type of dry eye. Whenever I see that, my brain is thinking, all right, well, we have to explain this. Either this person's dehydrated, and it can be over just general overall hydration, but a lot of the times it's medications, or I have to start looking for a systemic inflammatory cause. The autoimmune diseases are the worst offenders. Things like rheumatoid arthritis, lupus. There's something called Sjogren's syndrome, which is an autoimmune disorder that affects your mucous membrane. So it causes dry eye, dry mouth. It's 1 in 10 dry eye patients have this. So it's really underdiagnosed. It's usually your eye doctor or your dentist finding it first. So super important to keep up with those appointments because it ultimately can affect your entire body. But a lot of the medications we take, I have seen patients come in and just from taking a Zyrtec look like they have dry eye, and we come up with a whole dry eye treatment plan. They come in a few months later. Oh, by the way, I was taking Zyrtec and now I'm not. And their eye looks totally different. And that was the only difference. So you're absolutely right. Hydration has a lot to do with it. And again, great point about people don't think about the over-the-counter medications and telling your doctor about that. So that's why I have a dry eye intake questionnaire. And I've tried to pull out all of the things that people don't necessarily offer up to their eye doctor. I've got, say, do you take any of these medications? And it's the blood pressure medications, anxiety medications, antihistamines, sleep medications. They're all dehydrating. And I say to people, look, you are on all of these for a reason. Because people say, well, should I talk to my doctor? No, absolutely not. Your cardiologist is going to laugh at me if he or she has found the perfect cocktail for you. And I'm like, you have dry eye. I can fix your dry eye. You are taking all of your medications for a very specific reason, and you should be. But there's really simple things we can do, whether it's a lifestyle, nutraceutical, pharmaceutical, whatever. And I'm very sensitive to the fact that different people prefer to treat their dry eye different ways. And we talk about all of that. There's something that we can do for everybody. We have in-office treatments we do that are light-based, so we can totally avoid pharmaceuticals if that's the kind of personality that you are. A lot of the things that we do are more holistic in nature and actually trying to avoid pharmaceuticals. Sometimes you need them. Sometimes they're really helpful. But yeah, like I was saying before, there's a lot of tools in our toolkit that we didn't have even a decade ago.
I know I've had guests on my show that do the infrared therapies, different
Mhm.
red, blue, just things, and uh, your impulse when you hear that is, oh, let's go to Amazon and order these lights myself.
Mhm.
Uh, Brought up in a show recently that, you know, yes, you do a lot of laser work in the eye doctor's office and the clinics and things, but that's not something to do at home. You should not be using it. Like I have a Heliopet red light for my dogs, healing their problems, and they come
Oh,
with little goggles for the dogs to wear to make sure that I don't get any exposure to their eyes to protect their eyes.
love
Uh,
that.
so more and more that is getting common to treat wounds, all kinds of things, uh, and doctors are coming out of the medical schools now, hopefully more and more with the integrative focus. They know people are doing this. As we
Mhm.
have our insurance battles, there's going to be a lot more of that.
Mhm.
And so the purpose of my platform is to educate. It's okay. You just need to communicate with everybody. Everybody's got to be on the same page. Uh,
Absolutely. Yeah,
you know,
absolutely. And we do have red light therapy. I'm glad you brought that up in the office. It works so well for clogged up oil glands. It's really popular in here. But yeah, people will say to me, "Oh, I have a mask at Amazon at home," and I have a little kind of diagram I show them that talks about, well, okay, here's what the benefits you get from a mask on Amazon. And look, I'll be the first to raise my hand and say I used to have one of those Amazon masks, but it's hard with any light-based treatment to know all of like the geeky science details between, is that going to work? What's the wattage? What's the joules? Like, how close is it getting to your face? What's the spot size? What's the depth of penetration versus a medical grade mask? There's a huge difference. Red light is super beneficial for the eye. Blue light is antimicrobial, so we also have a blue light mask that we offer. But yeah, you have to be, and we kind of touched on this before, you have to be so careful with blue light because blue light can damage the back of the eye. We do say that you get infinitely more blue light when you step outside from the sun than you would off of a screen. But absolutely, it messes up your circadian rhythm for sure. So
yeah.
that research is out there about sleep in blue light.
One thing I've learned from this program, Doctor, is that we need to have several more programs. I think maybe one focusing just on the diabetic health, maybe another one, the macular degeneration.
Yeah.
Uh, we do need to wrap up to, at this time, but I'm just so
Yeah.
grateful to have you today. And, I could probably have you once a week and wouldn't deplete your wealth of knowledge here on all these topics, but it is important, and there are ways. You think you can't afford the expensive, but the pharmaceutical companies have ways to support people. A lot of
Hmm.
information more that I think we will have you back certainly for more information. But uh, I just want to thank you for coming. This has been fantastic. It's just I know a lot of viewers will appreciate the show, and we should be getting a lot more requests for other things, that related to what you do. So we will be seeing you again if you don't mind. This has been a great show. Uh, for the viewers, we are here every Thursday from 1 to 2 p.m. Eastern Standard Time. You can go on the YouTube and get leave comments or questions, and we can direct them to the doctor and, have this information on future shows. But I just tell you, I'm really grateful. We had a little slow start getting going today, but thank you for your patience and for, everything that you do, because I thought I knew a lot, but, I've learned so much, how much I don't know this year.
Oh, I
Yeah.
appreciate that. Thank you. And yeah, I would be more than happy to come back. I feel the same way. I feel like we just scratched the surface. I loved having you in as a patient. I feel like it was a really easy back and forth and easy flow of conversation. And I feel the same way on the podcast. So yeah, it would be my pleasure to come back. And there's obviously, I'm feeling the same way. There's just so much to talk about and so much to cover and so much I want the general public to know about their eye care as well. And as you mentioned, don't worry. The other thing I want to know, kind of parting words here that I wish everybody would know, is that everybody thinks they only can go to their eye doctor once a year. You can see your eye doctor through your medical insurance. You could see your eye doctor every day through your medical insurance. So it's not like, don't worry about access. We have ways of figuring that out for you.
So, all right. Well, thank you very much for coming today. You have a good week. I'll be in touch. And, this has just been a wealth of information. I have to sort it out and figure where we go next, but I can see at least 10 more shows with you. Thanks a lot. You have a good week. And thank you, everybody, for tuning in. If you enjoyed the show, please like and share and spread the word. If you have specific requests you'd like, we're happy to consider them for future shows. And everybody have a good week. Thank you.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern.